Hey, what is up everybody? This is Dr. Michael Hyland with Hyland Physical Therapy and Wellness. It's Wellness Wednesday, which means we're going to be talking about more ways that you can self-treat that pesky low back pain that you've been dealing with. Today we're going to be talking about something particular, very particular with self-treating low back pain. In other words, this isn't a one-size-fits-all kind of treatment. This is something that in particular can help. It's not always 100% the case, but it can help very much in cases of disc rupture or herniation, low back, and the low back in particular. So what we're going to be talking about today is called positional distraction. And that's what the title hinted at, is sometimes distraction is a good thing, at least when it comes to back pain. So, normally when we refer to distraction, we're referring to pulling something apart, or kind of traction if you think of it that way. Distraction in this case we're talking about is positional distraction, meaning we're going to be getting in a particular position, we're going to be taking pressure off of that particular area of the spine and allowing it to relax and open up. So just very briefly, hey Becca, thanks for watching. Very briefly, the anatomy on the low back. You've got discs between each vertebrae. Those discs are kind of like a jelly donut. They've got kind of an aqueous liquid, almost like a jelly donut type stuff in the very center. And then on the outside, very thick type 2 collagen fibers make this really thick outer woven structure called the annulus that's around that center of the jelly donut. So that disc has really tough fibrous cartilage, and then in the very center it's like a jelly donut. So it's basically like a fulcrum. So the movements of the vertebrae above and below kind of function like this. That jelly donut in the middle kind of gets squished around a little bit and acts as that pivot point. When repeated stress can, so like twisting and bending while lifting a heavy load, repeated motion, that can tend to wear out and make small tears in that thick annular fiber of the outer part of the disc. And then once that ruptures through and tears, you can have that jelly donut stuff squishes right out, and it typically is either to the left or the right. It's not necessarily typically in the very center, but very frequently left or right, and that's when you get that immediate left or right leg pain, that sciatica that can go all the way down to the foot in some cases. You get that excruciating back pain as well. And so this can be a technique that can really help, especially in those early days when it's really hard to do anything except lay there. But you can do a lot to take the pain to a lower level. And you don't want to do this very long at first, but I'm going to show you how to set this up at home, and we'll talk about how long to do it once we do it. But the point is taking the pressure off of that same side, the side that's painful. Typically with all that inflammation that happens plus the material pushing on the nerve roots, it gets really crowded in there, and so sometimes getting into a position where you can literally, so if my spine is this way, you can literally open up that side, that top side, take that pressure off the nerve root. That can really help with pain relief early on. So what you'll need is a pillow and a sheet. Particularly if your sheet, this is not quite what I would recommend, but this sheet is essentially folded in half. It's a little bit more than half, but if you have a bed sheet, fold it in half so that it's kind of long ways down your bed or couch. You want a pillow, preferably one flatter than this. This is quite thick, but it'll do for demonstration purposes. To create this, we're creating a bolster is what we're doing. So you're going to take your sheet and kind of roll it onto the top of the pillow, like so. And then we're going to roll that sheet and pillow together. You can see that on the camera. We're rolling that together. You see this is making a nice thick bolster here. And full disclosure, this might be a little bit thick, okay? This might be a little, that's why I recommend a flatter pillow. This is quite thick. You don't really need quite this much thickness, maybe half of this. But for demonstration purposes, I'm just going to show you this way. I'm going to turn the camera a little bit so you can see what it would look like in a lying position. So from the front, what you're going to see, let's say my pain is on my left side over here. I want the left side to be facing the ceiling when I lay down. This is going to be on my right side, so you're going to put this in above the pelvis and below the armpit, and preferably if it's a little smaller, it'll be a little more compact. I might show you with something else before we conclude. But you're basically going to take this and you're going to lie over it. Make sure it's still above your hip bones, your pelvic bones. You're going to lie over it. You want to put some pressure here, lie over it, and then allow the upper part of your body to relax like so. You can see this a little bit better from the back view, which I'll show you in a second. But this is going to be opening up this, the part that's on the top is going to be curving like so, kind of like, you know, you look at the top of a hill, you're going to be kind of curving that way. So that's really going to open up that side of the spine and allow pressure to be taken off the nerve roots in the back. I'm going to show you from the back view, and again, this is very thick, maybe a little too thick, so maybe I won't roll it quite as far this time. I'm going to show you from the back view. I kind of lost it there. So from the back view, let's say the left side was going to be up. Sorry, I keep losing my pillow. So from this side, it would be like so. Now you can see, maybe a little bit better from the back, how my spine is side bent toward my right. So that's opening up this part on the left side of my back. Later, when you're good at this, you can actually enhance it by taking the top leg and kind of crossing it over a little bit. So you get a little bit of a rotation with it, but I don't recommend that early on. So positional distraction, you literally don't want to do this more than about 5 minutes the first time. As a matter of fact, I would probably have a physical therapist do it with you first 1 or 2 times just to make sure, to monitor it, because if you do it more than, let's say, 5 or 10 minutes max the first time, it actually could temporarily cause more pain. It sounds counterintuitive, but I can explain that briefly. Just think of how when your foot falls asleep. You know, when your foot falls asleep, it's maybe even numb sometimes. When it comes back, it feels like a million fire ants are crawling on your skin, biting you. It's really not a fun feeling. Every nerve in the body can have reactions like that. And so when you have a disc herniation, you've got pressure on the nerve root that is for your whole leg, so in your back area. And so when you take pressure off of that for the first time, it actually can be kind of a negative reaction if you do it for too long. Just because you take that pressure off the nerve and then everything's waking up again, it can actually hurt worse. So at first, 5 minutes max, just 5 minutes. And if you respond well to it, try 5 more minutes and then add 5 more. And so you just want to do that once or twice a day, 5 minutes, 10 minutes at a time. Once you're tolerating it, and once that initial inflammation goes down, you could tolerate this for 45 minutes eventually. But again, it's not a slam dunk. Not 100% of cases respond well to that technique, but it's definitely worth a try if you've had a disc rupture or even a bulging disc, even if it hasn't gotten as far as rupturing or herniating. Just a bulging disc, you could do this technique, and that would be actually kind of almost preventative. It would take that pressure off the area, open up that side of the spine some. And bulging discs don't typically cause sciatic pain, but you can have local back pain on one side or the other. So I would recommend that for sure as a way to relieve pressure. But as we talked about in previous weeks, you know how to do spinal decompression now using a chair. And you know how to do pelvic tilts while you're doing that. So go back 2 weeks, last week and the week before that, to see those videos. But please recommend this and share and like this video with anybody you know that would need this or benefit from this. It's not a commonly known technique, but it definitely can be very helpful, especially in the very early days after blowing a disc in your back. Sometimes actually the first week or two can make a huge difference in your recovery. Taking pressure off the nerve, reducing inflammation, ice packs, things like that. But even more so, I would almost argue systemic steroids, if your physician is willing to prescribe that, can be very helpful as well to kind of reduce that inflammatory response. Hope you enjoyed this video. That's all I've got for this week. But we will cover more of these types of techniques. Probably relieving techniques we're about done with, but we're definitely going to start covering core strengthening and not only ways to prevent injury, but ways to recover from back problems if you're currently having those. Thanks for watching, Becca, and whoever else is on Team Replay. We'll see you next week for Wellness Wednesday. As always, be empowered.